Synaptic transmission at a chemical synapse involves many steps. Drugs that influence the normal activity at these synapses may act at any of these steps. A drug that enhances or mimics the effect of the endogenous ligand is called an agonist. A drug that blocks the effect is called an antagonist. In this tutorial, we'll examine how agonists and antagonists can modify the function of neurotransmitter receptors. Let's take a look at a typical ionotropic receptor. When an endogenous ligand, such as a neurotransmitter, binds to an ionotropic receptor, the receptor pore opens and the ions pass through the pore. Some drugs structurally resemble the endogenous ligand and affect the receptor in the same way. Such a drug would be an agonist. Because drugs come from outside the body, they're called exogenous ligands. Other drugs bind to the receptor at the same site as the endogenous ligand, but fail to activate it. However, because they occupy the receptor site, they prevent the action of the endogenous ligand. These drugs are called antagonists. While many drugs bind to the same receptor site as the endogenous ligand, some receptors, for example the GABA receptor, contain several different binding sites for endogenous and exogenous ligands. Drugs that bind to a different site than the endogenous neurotransmitter are called non-competitive ligands. Non-competitive ligands may either activate the receptor, in which case they are referred to as non-competitive agonists, or they may prevent the receptor from being activated by the transmitter, in which case they're called non-competitive antagonists.